everyone. What an amazing room full of people. We are so thankful to all of you who are joining us in person and online for this event focused on empowering eaters by improving access and affordability and expanding healthy foods for all. My name is Nierenberg. I am co-founder with Bernie Pollock of Food Tank. We are a research and advocacy organization really devoted to storytelling that highlights how food and agriculture can be the solution to some of our most pressing environmental and social challenges. We hope to inspire, motivate, and ultimately activate positive transformation in how we produce and consume food. I am so thrilled to be back in Chicago. Like, I'm giddy with how great it is to be here. And this is a city that holds a very special place in my heart and in Food Tank's heart. It's our 10th anniversary this year, and thank you. And it does deserve a round of applause. It's giving me chills too. We started Food Tank here in Ravenswood, and it's really exciting for me to have such a strong connection to the city. This is the city where my parents were born and raised and lived until they were in their 30s. For some reason, they moved south to Missouri and had me, but this is a place that I and Food Tank will always consider home. So thank you all so much for being here. I'm so grateful to all of you and a little bit emotional to see all of these great people in the room. And I also want to shout out that, this is a place, Chicago is truly America's food city, so I hope we can give that a round of applause too. Bernie and I are so excited to be back in Chicago because this is a really important event for us. We are coming together in support of the Biden-Harris administration's national strategy on hunger, nutrition, and health. Before I took the stage, you had an amazing opportunity to see the videos from organizations and individuals all across the country who are working to support the national strategy. And they're doing such great work right now, and I can't wait to see what's ahead for all of those great groups. The White House's leadership to end hunger, improve America's well-being, and reduce health disparities has been truly inspiring and makes me feel very patriotic, and I know Bernie does too. And I want to thank Catherine Oakar, Kellyanne Blazik, Will McEntee, and Emma Potter for all of their hard work to advance the White House's mission. They are extraordinary individuals, and I hope you get a chance, all of you, to meet them later today because it has been an honor to see them do their work. I also want to thank Farmers Fridge and especially Luke Saunders, Natalie Oxman, and Rachel Rochelle for being incredible partners on today's event. They are hosting us and providing an incredible lunch for everyone here in person today. Please give them a round of applause. They're awesome. And a homegrown Chicago company, it just makes me so happy. I also want to thank our partners at the United Nations Global Compact Local Network Initiative on Sustainable Food and Agriculture Systems, including Food Tank's good friend Mark Kaplan and Mustu for their generous support. This initiative, which is led by the UNGC Network Norway in collaboration with the UNGC Network USA and over 30 other country offices around the world, is really extraordinary, and they are particularly focused on supply chain resilience and food security in alignment with the priorities of the U.S. mission to the United Nations and the White House Initiative on Hunger, Nutrition, and Health. And finally, I just want to thank all of you again for being here. I'm really excited to see so many familiar faces and people I have admired my whole career. People like Jim Slama, who has been helpful since the beginning of Food Tank, my Shiro Earthworm cousin, who inspires us all, the great urban farming advocate, Erica Allen. Exactly, Erica Allen, please. Food Tank board members, Carrie McClyman and Regina Anderson, and so many of you who have been supporting us for so long. So thank you for that. I need to give you a round of applause. Today, you get to hear from 40 speakers, including policymakers, chefs, business leaders, nonprofit advocates, farmers, food justice warriors, and other stakeholders who are working to improve access to nutritious, affordable, culturally relevant, and delicious food. Before we start, let me just give you a quick rundown of the day. Our conversations will be very, very fast-paced and dynamic. If I have to cut panels short, which I'm kind of famous for doing, please forgive me. It's only meant so that we can have more networking and that everyone gets a chance to speak. And if you're in Chicago with us, there will be plenty of time to continue the conversations over a beverage or delicious food during our breakout sessions. There will also be an office hour with our guests from the White House, and we will share more details about that in a few minutes. And we'll end with a really cool reception. I know Lollapalooza is in Chicago this week. I've been. Our reception is going to be better, so do not leave before you get to go to that. And if you have questions during the event or you don't get to meet someone, please email me at danielle@foodtank.com. I'll be checking my phone all day, and I'll make sure that you get to be connected to the people you want to talk to most. I also want to make sure that you grab snacks whenever you're hungry, and please step out for bio breaks as you need them, get fresh air, but please come back as quickly as possible because I really don't want you to miss anything. Before we get to introduce our first speaker, I want you to also share your favorite moments or something that disturbs you or you want to criticize using the hashtag #FoodTank on all of our social media platforms. We will share questions and comments and respond in real time throughout the day. So now we get to get started, and I'm really excited to welcome our first speaker for the day, Kat Oakar, the Special Assistant to the President for Community Public Health and Disparities in the White House. Give her a round of applause, please. Hey, how are you? It's so nice to see you.
Good to see you.
This is always fun when Kat and I get to share the stage. So I want to start with the question that I think you get asked all the time. Why did the White House decide to have this strategy, and why is it particularly important at this moment in time?
Sure. Well, just hello, everyone. It's so good to be here, and thank you to Farmers Fridge. This space is amazing. I was talking to one of their staff team members, and they said this is the first time they've had a big event like this, and I think they're crushing it already.
They're crushing it.
So hopefully more events to come. So thank you so much, and thank you to the amazing Food Tank team. You guys are amazing. I think everyone in this room knows how amazing they are, but they are seriously unparalleled in how amazing they are to work with and how easily they put on events, or seemingly put on events, because there's so much work in the background. Super excited to be here with you all today. So just for a little bit of context, the last time the White House had a conference and kind of a strategy on hunger, nutrition, and health was in 1969, 50 years ago, during the Nixon administration. And the reason they had that was because hunger was really a huge problem in the country. It wasn't going away. It was very much on the president's radar. And so now, not only are we still tackling hunger, but we also are tackling diet-related disease. And so if you think about the statistics, 1 in 10 households are food insecure. Those with children face even higher rates. 40 million Americans don't live near a grocery store, don't have one nearby. But then we also see 1 in 10 Americans have diabetes. 2/3 are overweight or obese. And we're also seeing those numbers climb in children. So it's not just about adults, it's about kids too. And we're continuing to see those rates of hypertension, obesity, diabetes tick up as well. And so really we were facing these kind of two intersecting and hugely impactful issues at the same time. And so the president was super eager to make sure we were doing something about it, to make sure that these trends don't continue, but that we can actually take action and reverse the trends and make a difference. And so that's really why we did the conference last September, why we put out the strategy as well, and why we worked to galvanize $8 billion in external commitments, and why we are working to galvanize that second batch as well.
I think, Kat, what is impressive to me is that it just didn't end with that conference. I think many people sort of expected, okay, we've had this conference, people will do what they will, but you and your colleagues have really continued this commitment. That's got to be very, very hard work. It
is, but it's so worth it, and that's why we do the jobs that we're in. And before I kind of talk about some of the progress that we've made, I'm joined by my amazing colleagues, my partners in health, Will McEntee and Kellyanne Blazek. They're floating around here as well, and they're awesome. And we'll all be here today, so would love to speak to as many of you as possible. But we are really the ones that are leading this work in addition to our federal partners. And so, we can't just have a conference and expect hunger and diet-related disease to be solved. We have to keep our foot on the gas pedal, not only from the federal side, but from the external side, from the private sector side, the philanthropic side, state, local, territorial governments also have to keep moving because these issues are so complex. It's not a one-size-fits-all solution. And so that's why we're really trying to keep the momentum going, and that's why we love participating in events like this, because we can't stop. And we have such an opportunity here to really make change. I think we often see, and I feel like I continually say this, but often when we're talking, to folks who are somewhat like-minded, so who are interested in food policy and public health policy, we all get it, but I think it's finally starting to trickle out into the masses, and people are starting to understand the impact that hunger has on people's day-to-day lives, the impact diet-related disease has on people's day-to-day lives, and what that means for us as a country, as a society. And so, again, that's one of the reasons why we can't stop and why we keep pushing from the White House side, and hope you all will do the same.
Absolutely, and I feel like that's the only bright spot that we're getting from COVID, that there's so much attention placed on diet-related diseases and really figuring out ways to solve them. I'm wondering if you can talk a little bit about the pillars in the national strategy.
Sure. So we put out, for those of you who have not read it cover to cover, you can, but just to give you a little bit of a background, we were really focused on grounding ourselves in 5 core pillars in the strategy. So the first was all about improving food access and affordability, which is one of the pillars we're talking about today. As I mentioned, the stats on food insecurity, those without easy access to a grocery store. If people don't have access to food, if people can't afford it, how can we expect them to live healthy and productive lives? How can we expect children to learn in school when they're not getting enough to eat? And so that's kind of the focus of pillar 1, is how do we improve food access and affordability? The second is really all about integrating nutrition and health. So thinking about our healthcare system, how can we do a better job of integrating nutrition into what happens in our doctor's offices, into what health insurance companies are covering and our benefits. And so thinking about how we really make those 2 sectors almost one and get them to align and merge in ways that we haven't seen. We're starting to see it little by little as we start seeing food as medicine take off and Medicaid programs start to cover nutrition services, but we need so much more, and again, the opportunity is so rich there. The third pillar is all about empowering Americans, empowering adults and children to make the healthy choice, and we often talk about making the healthy choice the easy choice. So how can we set Americans up to be able to make healthier choices? So often, I always think of my dad, who's a type 2 diabetic, and he'll go to pick up his diabetes medication, and he'll go into the store, and he'll be surrounded by not great food while he's going to get his diabetes medicine. And it feels like he's almost set up to fail because he's so tempted by all of these foods that will not help his diabetes while he's walking to get his diabetes medication. And so how do we think about what retailers, what food companies can do to make the healthier choice the easier choice? And then pillar 4 is all about supporting physical activity. Of course, food plays such a huge role here, but physical activity plays such a huge role here too, and we know the vast majority of Americans don't get enough exercise. Kids don't get enough exercise, and so how can we really make it easier for Americans to get physical activity and to be as active as they possibly can be and want to be? And then the last is all about research, and so we know a lot about nutrition and food, but we don't know everything, and I think we continue to see that research emerge in terms of dietary recommendations, in terms of what drives people to eat the way they do. And we know that, again, this isn't a one-size-fits-all approach, that depending on where you're from or who you know, you'll have different preferences. And so how can we build that into the research that not only informs federal policy, but how we work to improve Americans' lives as well?
It's really exciting to me that all of these different pillars come together to build momentum for all of us, to empower all of us, whether we're businesses or nonprofit advocates or policymakers. And I know you're seeing so much momentum. We showed all of these videos earlier, and it's really inspiring to me to see all of these different businesses who maybe didn't care about these issues 5, 10, 15 years ago, who now care about them and are working, I think very conscientiously, many of them, to do this. Are you surprised by that?
I'm not. I mean, I think I'm pleasantly surprised in some ways, but I do think you're right in that COVID shed a light on this in a way that we weren't expecting. In a way, COVID was terrible in so many ways, but in this context, it was almost a blessing in disguise. I'm not sure if you all were like glued to the TV as much as my family was during COVID, but I remember in the early days how the headlines would be: if you have diabetes, if you have heart disease, you are at higher risk for severe COVID. And for many of my friends and family members, it was like a light bulb of, oh my gosh, how do I get better and get better right now? And so I think that shed a light on the fact that we were moving in the wrong direction. And so it's been awesome to see so many different players come to the table and recognize that, you know, and I think from the White House perspective, we're not expecting this to just be doing it for the betterment of the country, but this can be good for business too. I think we know that Americans want healthier choices. They want to make healthier choices in their day-to-day lives. And so I think it's been tremendous to see how many different actors have come in. And we've seen everyone from places like Walgreens to S2G Ventures, which is based here in Chicago, and Food Systems for the Future, which is Earthrin's entity, all the way to, you know, philanthropy and nonprofits and major retailers come in and say they're committing to doing some of this work and making the healthier choice, the easier choice, and really focusing on how we can reach our goals of ending hunger and reducing diet-related disease. Yeah,
I think, Kat, what convinces me that this can work, that this national strategy can really work, is that businesses, the private sector, are really learning from nonprofits and people who've been on the ground, food justice advocates. They're finally listening. That's really cool.
Yeah. I mean, I think, and so many of you in this room have been doing this work for years, and hopefully you're starting to see some of that pay off, and hopefully you saw some of that work come through in the strategy. I think many of you in this room submitted comments when we were working to develop the strategy, so thank you for that, and know that we literally read every single one of them, sometimes twice or 3 times. And so I think, you know, you are the experts here. I think we have the benefit of learning from you all who are doing the work day in and day out and see how things change in communities. And so we're looking to you all to help us, to be part of this journey, and to show us what more we need to do as well.
And you and Will and Kellyanne have been meeting with so many different leaders, especially over the last few days here in Chicago. How are you connecting them to one another?
Yeah, it's a good question. So just to give you a little bit of background, so we've been working and meeting with folks for the last 6 months. So in March of this year, we launched the White House Conference to End Hunger and Build Healthy Communities. And we did that to really galvanize the next batch of commitments. We had, as I mentioned, we had $8 billion worth of commitments come in for the conference, which was amazing and unprecedented in many ways. But it's not enough. Ending hunger and reducing diet-related disease by 2030 is not that far away and is a huge systemic task. And so if we're really going to make a difference, we need more. And we're also thinking about it from how do we reduce disparities, because we don't want to make the world better for some while we continue to leave others behind. We know disparities persist in rural communities, communities of color, military communities and families, veterans. And so we're really thinking about how we can, from the federal side, do as much as we can, but this is where many of you all come in as well. And so that's really what we're kind of focused on right now. That's why we're meeting with so many people on the outside to understand what's happening, but also to encourage you all to join us, to make a commitment that we hope to lift up sometime in the fall, September or October, with another White House event, not another conference, but another White House events where we showcase the next batch of commitments that have come in and really highlight some of the great work that is going to help us reach these goals.
I mean, what's clear, this can't happen without collaboration.
Absolutely.
And that's what forums like this are about, just making that collaboration happen. I wonder if you were as worried as I am, how the momentum around the national strategy will continue beyond this administration.
I mean, I think that's one of the reasons why we from the federal side are so focused on the policy end and making sure that we plant those seeds so that they can last long into the future. While we're putting out rules to make school meals healthier, while we're putting out rules to reduce sodium in the schools or in the food supply, while we're conducting studies and eventually proposing rules to put labels on the front of food and beverage packages, we're trying to really plant those seeds from the policy lens. But that's also why we're asking you all for big, bold, sustainable commitments. Work at the fringes. Drop in the bucket here and there, a donated meal here or there makes a difference, but it doesn't mean it makes a sustainable difference. And so that's really why when you hear us talk, you hear us talking about, we're thinking of big, bold commitments that will really lead to transformative work, transformation in the food system and the healthcare system and in society, because that will long outlast this administration. And that's the point. We don't want this to only be a thing while the Biden administration is going. This is very much something we consider not only bipartisan, but nonpartisan, because this is about the health of our communities, about our families. And I think everyone can empathize with having somebody in their family who has diet-related disease, or somebody in their family who has experienced hunger, or they themselves who have experienced one or both. And so I think we're really trying to make it such that this is not an issue for one administration or the next, but for every administration.
That is truly transforming government, healthcare, as you said, and our culture, I feel like, in so many ways. And that takes a lot of effort, again, why we're all here to really get that going. I wonder if you can just talk for a few minutes about the huge effort it took to get all of these government agencies to work together last year and then continue those efforts.
Yeah, so our strategy was across 20 federal agencies and 20, and some people don't even realize that there are 20 federal agencies, but there are. And so, because we're thinking about it, we often say a whole of government approach, and I think often people are like, what does that even mean? And it means that if we're going to solve these issues, if we're going to really make a dent in these issues, it's not just the Department of Health and Human Services. It's not just the USDA. We have to think about it from the Department of Defense. What are we offering on our military bases? How are we training our military members? What food options are we giving military families? How are we taking care of our veterans? How are we encouraging transportation to be easier for people to access grocery stores? So that's the Department of Transportation. What are we serving in our national park systems? That's the Department of the Interior. How are we educating our students? How are we making physical activity more prominent in our schools? And so we're trying to think about it from every single lever that we possibly can from the federal side. And so when we talk about a whole of government approach, and one of our colleagues, Laura Carroll, who was on our team and is now back at the FDA, is here today, was instrumental in making that happen as well. It is a lot of phone calls. It's a lot of recognizing that you speak different languages and trying to figure out what the common language is, which is often kind of the common goal, which we were operating from. But it's not easy because the federal government's pretty huge. But it's essential in this work, because if we're not coordinated, if we're not all rowing in the same direction, we're not going to have as much of an impact as we need to.
Absolutely. So final question before I let you get to meetings and talking to more folks. I'm wondering what you're looking most forward to from today.
Sure. I think talking to many of you and hopefully seeing some of you coming in and making commitments. I think, when we're thinking about commitments, we're thinking about how can food companies offer healthier options. We're put out the proposed rules related to making school meals healthier. How can we make sure that there are plentiful options for kids to eat healthier school meals. So that includes how do we make sure that there are healthier foods and beverages on the market for schools to purchase and offer. I think how can we think about what the retailer environment looks like and really transforming that or trying new things, because again we recognize that it has to be good for business as well. And so I think speaking to all of you and hopefully getting to hear some of your interest in coming in and potentially making a commitment, but we're absolutely eager to work with all of you. And for those of you who are tuning in to the live stream, if I think I'm looking at the right camera, we're happy to chat with you as well. And so I would encourage you to go to whitehouse.gov/Hunger Health Conference. Again, that's whitehouse.gov/Hunger Health Conference. And scroll down and you'll see White House Challenge to End Hunger and Build Healthy Communities, and fill out an interest form. It's super non-committal. It generates a conversation with us and our amazing partner, the CDC Foundation, with whom we're working with on all of these, to see what might be possible, to refine and to brainstorm what a commitment could look like that we can potentially lift up come September or October, because we need you, and we really are hopeful that the Chicago landscape can step up and help us in this effort.
Chicago has been stepping up. It's so exciting. Kat, I know that this work is difficult but also inspiring, but I want to thank you for your service to our country.
Thank you so much. Well, I so appreciate it, and kudos to my colleagues Kellyanne and Will, because they're my partners in health on this and are right here, and hopefully you'll get to meet them as well. But it's a privilege to do it, but we can't do it without all of you. So look forward to talking more, and thank you, Danny, for all that you guys are doing.
Round of applause for Kat, please. Thank you.